to the world of chiropractic, where we take one epic journey around the world as we explore the 7 regions of the World Federation of Chiropractic. My name is Dr. Rebecca Wilkes, and I invite you to travel with me as we go on this exciting adventure around the globe. Today we have the president of the American Chiropractic Association, Dr. Michele Maiers. Thank you so much for joining us, Dr. Maiers.
Yeah, it's a pleasure to be here. Always great to talk with you, Rebecca.
So you are current president of the American Chiropractic Association. And what are your current initiatives?
Our top advocacy priority is modernizing chiropractic coverage within the Medicare program in the United States. So right now, currently, there's only one service that's covered for chiropractic care, and that's adjustment of the spine to correct a subluxation. And we know chiropractors do so much more than that, including the physical examination, maybe some imaging, lots of different modalities, exercise, and other best practices for managing, a broad array of conditions, not the least of which is spine care. So we are working with our congressional representatives to pass a bill. It's House Resolution 2654 to expand the services that Medicare beneficiaries can see a doctor chiropractic for. Basically, we want to expand it to include the things that are within a chiropractor's scope of practice in their state, which is how Medicare looks at coverage for a lot of other physician level healthcare providers in the US, and we want to be treated on similar grounds as they are. So that's our top advocacy priority. We're also doing just tons of other things as the ACA, really taking what we perceive as our role of being the standard bearer in chiropractic in the United States very seriously. So lots of great continuing education and information for our members relative to treating special populations, really becoming a lot more culturally aware about diversity in the United States and the lack of diversity within our profession, and really tackling that head on in a lot of different ways. So we've got a really full plate of great things to do, lots of good things we do for our members day in and day out to help make sure that they are hands down better chiropractors in the United States, caring for all the communities and populations we care so much about.
And aside from the recent events of 2020, 2021 in the world, it sounds like ACA is just charging right ahead with a goal in mind.
We absolutely are. And it's interesting. I mean, so much of our lives were on pause with COVID. And yet in the meantime, there are major public health crises that continued on. The opioid abuse epidemic still ravages communities in the United States. Our population continues to age, and we've got a whole segment, a whole demographic of citizens in the US, and I know much of Europe as well, who we aren't prepared to care for into old age. And so we need to keep those people functionally active and independent. So, another really important thing for chiropractic to focus on. Pain is grossly undermanaged or mismanaged. That kind of goes back to the opioid abuse epidemic. But, 1 out of every 3 Americans reports having chronic pain that's not managed, opioids aside. So, that remains a really big public health concern. And then, of course, the no-brainer for chiropractic, back pain is the leading cause of years lived with disability in the United States and worldwide. So, there are all these public health issues that we have got to keep our eye on. And, it would be ridiculous to call COVID a distraction, but we have a really important role to play in the healthcare system to address these public health concerns, and we have to stay laser focused on those.
And that makes sense because, you have all of these quarantines that have happened this last year, and the number one thing that happened is people became inactive, right? And then what happens when you have inactivity?
Absolutely. Or people are working at home in terrible ergonomic situations, myself included. The stress of the year really had an impact on folks. So I'm so delighted about the World Spine Days theme this year and the campaign. And it's really about getting back to being back to our normal selves and staying active. And I know ACA celebrates National Chiropractic Health Month, which is October and overlaps with World Spine Day. And our theme is really about, staying active, being physical, and getting back to our normal, and maybe even a new normal for a lot of folks, just really taking care of ourselves and being as physically active as we possibly can.
Right. Getting back to back in a pain-free sort of way.
That's the goal. But and if it's not pain-free, just having the physical capacity to get back to back. The idea about being pain-free, that is within reach for some and out of reach for others. And I think that's where chiropractic has such a really important role to play in managing back pain, other musculoskeletal conditions, because it really is about optimizing your function. I think almost more than pain relief. And we know we bring pain relief to lots of our patients, but we also are looking at other things and not just deadening the pain, which is, again, coming back full circle to the opioid abuse epidemic. If getting rid of pain was the only goal, that would be our solution. But there's so much more to really managing these conditions in an evidence-based way, and in a way that is truly patient-centered for the long run. That chiropractic really, has a strong role to play and an important perspective to offer.
It makes me think of the social determinants of health.
Absolutely, absolutely. And that's one area that I feel like as a profession, we, at least in the US, have not spent nearly enough time really focusing on. There are some chiropractors who work at federally qualified community health centers or who serve, medically underserved areas. A lot of chiropractors work in rural America, which is how I got exposed to chiropractic as a kid. And all of that is super important. And yet our demographics are changing and changing so rapidly that we really have to be looking ahead 5, 10, 20 years and making sure that our chiropractic students are prepared to treat, the America of, 2030 and beyond. And that we as a profession are creating connections and collaborations with folks to make sure that we are doing everything we can to help decrease the disparities that exist in healthcare today, and so many of them stem from these social determinants of health.
I imagine as part of the American Chiropractic Association, you are always kind of looking ahead and having to see the next thing. And I can only imagine how that's got to be being a leader in the profession.
Well, that's your job, that is your role. I think lots of people think, you get to be the president of an organization or on a board, and it's a lot of power. And really it's a lot of responsibility to be looking around every corner and really getting creative with what does the future hold, and keeping your eyes on all the trends and thinking about, okay, what do we need to do as an organization, as a profession, to really prepare for what lies ahead. And I think that's, that kind of strategic thinking is the greatest responsibility of any leader in the profession.
What are your thoughts on the current limitations and or maybe a few future limitations to the profession?
I think our limitation is focusing too much on the limitations, honestly. There is so much opportunity. We have a great story to tell. We've got terrific patient support. We've got evidence that really supports what it is chiropractors do day in and day out in their practices. And as we discussed before, there's this confluence of a lot of public health needs that are so perfectly suited for chiropractic. And so I think our limitation is focusing on our limitations or what we don't agree on, or, the struggle within the profession. And honestly, I think, you reap what you sow, right? If you give attention to something, that something's going to grow. Whatever you resist persists. So I would much rather put my energy into all those really great opportunities. And I think that's what I've done with my career. That's what I really try to focus on as a leader, and getting our board, our members, our leaders really organized around the tremendous potential we have to help solve some of these public health issues in the United States, to really actualize all the terrific things we can do and be as a profession, and really make people proud of being a chiropractor.
Yeah, we are so unique. Let's move a little bit larger. You were past vice president of the World Federation of Chiropractic. You were past board member. You were past everything in the WFC, which you have now stepped aside, allowed other people to take leadership roles so you could fully concentrate on the ACA. But what is your perspective on the development of the profession, not only in the US, but within the North American region?
Yeah, it's interesting. I think people think North America and it's US and Canada, but there's a lot of other countries for whom chiropractic is in a very different place, an unregulated place, an emerging place, new schools, gaining some traction, trying to get some kind of cultural authority within the healthcare systems there. So really the North American region does encompass, certainly more than the US and Canada in our interest. So, I think about, how is it developing? What is the story? It's almost two stories in those regards, but across the board in North America, I mean, we have so many resources, and we are, in an area where, I think there is such a high concentration of chiropractors that we can build community across the North American region to really help support one another, help support ethical, patient-centered, evidence-based, collaborative chiropractic care, and really make that a commonly held mantra that chiropractic across the region holds. And I think that that's reflected in the WFC's principles. I know it's certainly the pillars of the mission and vision and values of the ACA. And I think those are things that we all can rally around. So I think that as I think about how chiropractic is evolving in North America, that's got to be the common thread throughout.
Right. And it almost seems like a micro to macro perspective. If you start with the proper foundation, you only build up from there. And I imagine that would translate globally also.
Oh, absolutely. And, if you start with that foundation, we can't go wrong. If we are really focused on the highest ethics, if we are thinking about patient-centered, evidence-based, collaborative chiropractic care every step of the way, we cannot go wrong as a profession. Now, maybe those things sound easier said than done, but maybe the best things are elegantly simple. And I think that if we all commit ourselves to that, whatever differences we have, techniques, philosophies, I think all that falls by the wayside. So, it's kind of people ask about how do you identify as a chiropractor? Are you this, are you that technique? Do you see this population or serve that community? And it really is, let's just orient around those core things that should be central to all of our practices, and we cannot fail as a profession.
I consider myself a chiropractor because that was my training, but I actually, more above that, I consider myself a healer because that's what I do. I look at the person, I try to heal them with what I know and the knowledge of my best ability. And if not, I can refer on to give them health from another perspective, right?
Yeah, absolutely. Absolutely. And I think that's, that's really a beautiful thing to share. And I think that that's where we maybe are struggling a bit as a profession, striking this balance of being, evidence-based. And the beauty of the true definition of evidence-based, medicine, evidence-based healthcare is it's this triad, it's not just driven by research, but it's also your own clinical expertise as a healer and your connection with the patient and their preferences and their past experiences and how you are interpreting and processing all three of those things. And that, I think is the truest definition of evidence-based medicine. And that's the one that I think, instead of feeling restrictive, can be really liberating and honoring all those different components of clinical care.
Yeah, because you hear the term evidence-based, you think it is strictly evidence-based, but you forget about all of those papers published that talk about the components that you just spoke about, right? The clinician experience and the patient preference and all of that. And that leads me to the Be Epic campaign, right? The evidence-based is the first part of the Epic slogan with the WFC. And so how would you say that the Be Epic campaign translates to maybe your life and or your life translated within the American Chiropractic Association?
Well, I mean, it was like a big cheer from me as soon as I heard, or as we were talking about it. I was on the board then at WFC, and Richard Brown and his brilliance came up with this killer acronym, and it's like, well, yes, of course, this is the common thread. This is the thing to unite us. We talk about a unified chiropractic profession. This is the thing we rally around, and again, it translates so well whether you have a niche practice or you are in a multidisciplinary, maybe hospital-based system, whether you are working in rural Uganda or you are in inner city New York. I mean, it is just such a perfect unifying theme for us. And so I'm so proud of the WFC for really branding that and making that really the North Star for a lot of the work that WFC has done over the last couple of years. And I remember, you know, and the executive on the board and serving with the rest of the board members at WFC, I mean, we kept going back to that. This be epic. And everything we did, this was sort of our litmus thing against, you know, is this being epic? And it's so nice when you have that kind of clarity of what you want to rally around. And it's, you know, something that's so easily marketable. Who doesn't want to be epic? And it aligns perfectly with ACA's mission as well. You know, all those components are absolutely part of our brand at ACA. And those are the things that we feel, you know, it really takes to be a hands down better chiropractor. And so, you know, we're doing everything we can as an organization to both, you know, walk the talk of those principles and reflect it back to WFC as a constituent member.
Right. And you know what I love about that is that the center of that is the patient or the person, right?
Absolutely. The person and sometimes the population that you're caring for too, you know, thinking on multiple levels. But, you know, absolutely, if this isn't about the patient, the person, you know, we've spent so much of our time as chiropractors talking about ourselves and arguing about ourselves and thinking about ourselves and our history and who we are today. And, you know, all of that is important. I don't mean to discredit any of it. And yet, what do we lose by focusing on ourselves instead of our patients, right? The people we serve. And if we, again, sharpened our focus to really put our energy into that, you know, it's exactly the direction we all need to be moving.
Any form of health we should be revolved around, right?
And it's the reason we all got into this wonderful profession, right? We wanted to help others.
Right. And speaking of, you said something about rural America, you being introduced to chiropractic, getting into the profession. What made you choose chiropractic?
Yeah, I'm a small town Iowa girl, and you know, the local chiropractor was the only healthcare provider for, you know, 45 miles. So, you know, I grew up seeing a chiropractor for all kinds of healthcare conditions, and the chiropractor was really the go-to person in our community for healthcare. So, you know, I've always been exposed to chiropractic. I knew I wanted to go into a healthcare field, and I really kind of floated around between a couple of different options. And just sort of, you know, kind of came back to chiropractic because it really aligned with my personal healthcare philosophy about self-care and about, you know, not using pharmaceuticals or invasive interventions when possible. You know, there's absolutely a time and a place for all of that. But, you know, I grew up on a farm, and, you know, we had all kinds of health remedies for things, but it was a lot of folk medicine, and it was a lot of, you know, really what can you do to heal yourself. And so there was something about, you know, conservative care, and chiropractic care was the closest thing I identified with that really seemed to resonate for me as a career.
Right now, you are the executive director of the Center for Research and Innovation at Northwestern Health Sciences University, but you also have an interest in non-pharmacological interventions for musculoskeletal conditions, particularly relative to healthy aging. How did you get interested in this?
You know, I love working with older people. They're the best patient population ever. I am super close to my grandparents, and I think they really, as I've watched them age, and, you know, they're the kind of people who, Rebecca, have a better social agenda than you and I put together. And I just so admired how they have aged. And then as I saw them get really quite old, I really grew to appreciate how tenuous their functional capacity was, and how so much of their health and well-being was tied to, you know, whether or not they were fully functional. And it just seemed to me that, you know, when I was in school or just starting my career, pain was the focus. That was the outcome measure we really emphasized. And it really opened my eyes to shifting more towards disability and functional capacity, and really making sure that, you know, we're helping support older adults to age in place and to do so successfully in whatever ways they want to be successful at that age. I mean, that might be, you know, getting on the golf course 3 times a week. That just might be, you know, being able to walk across the street to get your mail. So it can mean a lot of different things for different people. But I found this population so gratifying to work with. They're just delightful people. We have so much to learn from older adults. And unfortunately, I feel that they're a segment of the healthcare population that is overlooked until they're a medical emergency. And it's just this perfect sweet spot where chiropractic, can step in to really help support their goals for healthy aging. And I know healthy aging is over a whole lifespan, but my research has really focused on folks over 65. And so, I talk to a lot of student groups, and I'm always, asking like, what kind of practice do you want to have? And they're all into professional sports teams or pediatrics or treating pregnant women. It's like, all that's important, but if you really want to have a successful practice, treat old people. And I think more and more students are kind of getting into that because, obviously it's a rapidly growing segment of the population. The graying of America is a pretty serious public health issue in the sense that we're not prepared for it in any way. And I know, Europe has aged much more quickly actually than the demographics in US and Canada have. So, it's something we have to keep our eyes on, and it's something that the system as it currently stands doesn't have a lot of solutions for, right? We're not prepared to care for these folks medically. We're not prepared with housing. We don't have communities designed for them, transportation, workplace needs. And it's just, again, a really great sweet spot for the chiropractic profession if we choose to step into it.
It brings us kind of full circle to Medicare. I mean, you look at the reimbursement structure for that when you were saying that we're only allowed to basically adjust. Well, how do you go to adjust somebody without performing a physical exam? How do you go without using other modalities that might actually help out in the process, but you're not reimbursed? So what incentive is there for anyone out there,
Yeah, it's antiquated, it's illogical, and passing this bill is really common sense conservative care at its best, right? Let's steer older adults towards chiropractic services for particularly and especially musculoskeletal complaints to help keep them functionally active. And we know that we can do so in a way that is evidence-based, that is collaborative with other healthcare professionals, will likely save the system money. I mean, it is a win-win on all fronts, and it saves older adults the ridiculous pain of bouncing around the system to see lots of different providers, just to manage, let's say, their chronic low back complaint. So, this would really help streamline care for millions of Americans who, let's just make this logical for them.
Yeah. It makes sense.
It makes sense. And, luckily that's been the response we've gotten from a lot of congressional representatives. And so we're, collecting co-signators and, working our way towards having the bill heard in Congress and, or included in another bill on Capitol Hill. So we're really optimistic. We're very bullish on it. And really, there's a saying in the US, like, so Medicare, as Medicare goes, so goes the rest of healthcare insurers. And so it's so important for us to have full physician status within Medicare, because Medicare sets the tone for so many other third-party payers here. And this really, I don't know what the future holds with, a Medicare for all or decreasing the Medicare age, but increasingly in the United States, the trend has been more and more Americans part of a federal health plan, whether it's Medicare or Medicaid. So it's so essential that this is a corner we're looking around, that chiropractors get placed favorably in all of these systems in a way that helps support the healthcare within these systems, helps supports the populations we serve, and gives our chiropractors solid practices, lots of opportunity in their businesses and practices moving forward.
Like you said, turning the corner, looking ahead. Always.
That's right.
Well, speaking of being interprofessional, speaking of advocacy, you're a board member of the Integrative Healthcare Policy Consortium. Can you tell us a little bit about what this organization is?
Yeah, it's a multidisciplinary group. And it's folks who are just really into integrative healthcare. So, chiropractic and acupuncture and massage and naturopathy, but also a lot of physicians. I would probably say half of the group are physicians groups, and then also some groups who are really focused on specific patient populations. And we're all just working together to really advocate for federal legislation and spending to increase access, decrease barriers to integrative healthcare. So it's a really interesting group to be involved with. much of what we do at ACA kind of dovetails with the work at IHPC. And, we're just kind of thinking on kind of a macro level, how do we, how do we get agnostic about, the credentials behind someone's name, and instead allow people to practice at the top of their license and really empower them to deliver the health and well-being that they have been trained to do in a system that's really been designed to be super narrow. So it's really, advocating on behalf of specific pieces of legislation, working with the now Biden and Harris administration, reaching out to all of our different federal agencies who control different parts of healthcare to really give a voice to integrative healthcare practitioners and the integrative healthcare community, again, to really achieve all the public health goals and the private healthcare goals of the American healthcare system.
Oh, interprofessional and collaborative. There we go. We finished the, I'd say sentence, but acronym, I guess you could say.
You did.
Well, you have received a very high honor, which is being a fellow of the International College of Chiropractors. Can you tell us a little bit about this?
Yeah, it's really, it's a fellowship, a community of leaders in the chiropractic profession. Gosh, I don't know how far back the ICC goes, but the fellows get together annually at the ACA's conference typically, and it's just a great collection of leaders. It's kind of a humbling group to be invited to be a part of, and you just really realize how far we've come as a profession, all the intellectual capital that is in leadership within chiropractic. Lots of different people doing really brilliant things and being great leaders in their own little pockets of the world. So it's a terrific community to be a part of. And I was honored with it several years ago, and it's been fun to honor some other people this year and invite other fellows to be part of the community.
And I imagine that also kind of allows you to have a lot of camaraderie with thought leaders around the globe to be able to even just have an edge on that thinking ahead.
Oh, absolutely. Absolutely. It's just such a good peer community to explore new ideas, to get your fingers on the pulse of what's happening in different pockets around the world. And, that's why, selfishly as a leader, I loved being on WFC's board. It was the place to really get a sense of the state of chiropractic around the world, not just what it is, but the inside track on who is leading, how they're leading, what could be leveraged, what do I have that they could leverage. Again, it's about building the sense of community among the leaders within the profession.
You have been involved in everything. I mean, you can check the show notes with this for some of all of the highlights of what you've been involved with, including the American Public Health Association, all these other associations. And you also have quite a reputation with the students within the field of chiropractic. You even have an award named after you for a yearly award with the Young Professionals Group with the American Chiropractic Association. So very much an honor. And with that being said, I know that they will most certainly be listening to you, number one, about this. Do you have any advice for them if they want to, maybe become a little bit more involved in advocacy or within the field of chiropractic?
Just show up. I mean, there is so much talent in this up and coming generation of early career chiropractors. I am humbled all the time. I learned so much from working with students and early career practitioners that it has really shaped my leadership today in ways that I couldn't be as good as I am today had I just been following the mentors who have come before me. It's got to be a balance of both, right? Both directions. So, it has just been a total pleasure working with students and working with early career practitioners. And, any advice is just, show up. Your age is not a barrier. I remember spending a lot of years, especially as I was getting my research career going, hating my age, right? And feeling like I was just always junior, even though I often had, quite a lot of experience or really good experience and great ideas. And so, I think know your value and show up with that. As a millennial or a Gen Z, you have gifts that, Gen Xers like me don't have, and boomers don't have. Bring that to the table with a sense of humility and curiosity, and you will be welcomed. And if you're not welcomed, find another group, because lots of people need great talent. Find me, and we'll find a place to plug you in, because Last time I checked, we weren't full of, we weren't capped out at leaders, right? Everybody's a leader in their own way. So show up in a way that makes your heart happy and really leverages your talents, and just go for it. It's one thing to have a job, but it's another thing to have a career, and chiropractic is a career on many levels. And I firmly believe that getting involved with your professional association is absolutely an essential part of having a career. So, if you're somebody who's just kind of been sitting back and watching people like Rebecca, jump into different opportunities and cheering her on from the sidelines, that's great, but we need you to. We need you to be an advocate. We need you to, contact your policymaker relative to chiropractic legislation. We need you to have a voice at a local membership meeting. We need you to, be a positive influence on social media, chiropractic social media. There's so many ways to contribute and lead. I think that's what's so interesting about this point in time. You don't have to be the president of the ACA to be a leader in chiropractic, right? You're a leader in your community. You're a leader to the patients you serve. You're a leader in your cohort at school. Use this time to really develop your leadership skills, and then just show up, but do something. Do something. We need you. Our profession is too small for anybody to be sitting on the sidelines.
Maybe you are a chiropractor, but maybe you're passionate about, social media, be an influencer in chiropractic, right? Yeah. So I guess you're saying you can the box is not there, the box is there to think outside of, right?
What box? I see no box. There's no box.
There's no box.
This idea that you should be something or you have to do it a certain way, it is so irrelevant today. I think there was a time where, if you want to be a leader, you go through these roles and you get involved with this and then you do that. Today, gloves are off. Be you and step into the ring.
And be epic.
Yep, and be epic. Do that while you're at it.
But Dr. Maiers, thank you so much for letting us peek into your mind and see how you think and, how you're leading the profession today. What a treasure to have. Thank you so much for how much time you donate to just getting us, one step ahead and making us hands down better.
Absolutely. It's been a heck of a ride, and the best part of it is working with folks like you. So thank you, Rebecca, for all the ways you lead.